transplant patients to ensure compliance to appointments, labs, medications. So case managers could supplement your post-transplant coordinators and basically triage the patients, the appropriate patients, back to your center. You could receive a dashboard to help follow your patients to ensure continuity of care. Would a concept like this be interesting to you?
I think the dashboard would be interesting. Some type of perhaps emails set up to say that your results have arrived. The first part of it, I just don't know, but from the HIPAA perspective, whether that could be HIPAA compliant where, coordinators were, from a company's perspective, we're actually following, protected health information of patients in a practice. I don't know if that's, I get it that they know the names and they're processing the test results anyway. I get that part, but where they actually participate in the ongoing care, I don't know if that's really allowed or not.
Gotcha.
That would be something, we have to. I'm just not. The only reason I say it is I'm not seeing that necessarily with other products like this. You get a CMV blood test or a BK blood test. Nobody's necessarily following those patients except the providers.
Okay. All right. So that would have to run through legal. But the general theme of trying to help improve adherence, any opportunity there with that idea?
Yeah, I think that idea is a good one. As far as improving adherence, the patient would have to understand, of course, who the coordinator was and what their role was, so that they would not be confused about their role versus what the role of the transplant clinic or the program was in their care. So I think that would need to be explained, and everything would need to be in unison. It need to be synchronized well. But certainly you're right. It probably could work. There could be some overall benefit to it.
Okay. Just one more concept, and then we're going to wrap. I see that we just have about a minute left. The third idea is a patient app that helps track medication adherence. The transplant center can receive a dashboard to follow patient adherence or receive alerts for higher risk patients. It could be integrated Yep.
Yeah, it's interesting. The question is who's going to enter the information in the app, I guess. Is it electronically? So, for instance, the reason I'm asking is, you have pill bottles, and how do we know if the patient took the medication or not? There is a concept of the electronic pill bottle where you open the pill cap, and they, know that, a pill has been taken or whatever. This is what some of the studies are done with. But how exactly this app would work? If the patient's doing the documenting, they can fudge the data. That's what I'm trying to.
Yeah. Integrated with the center's EMR.
Right. Yeah. That there'd be nothing. Yeah. Certainly that could help. I'm just wondering how the data recording, would be done from the patient side. That's all.
Gotcha.
Is the patient going to be entering the data in the system, or how exactly does that data, make it into the electronic health record? Where does the data come from?
I see. Okay. Great. Well, this has been a very helpful conversation. Great feedback. Any other important considerations about AlloSure and its perception or utilization in the marketplace we should be thinking about?
No, I don't think so. I think you guys are aware that, there's a product called Natera that's being studied. That's probably going to be a competitor to AlloSure. Maybe even, according to the Natera data, maybe even more, all publicly available data, but, maybe even more sensitive and specific, than AlloSure. So I think there's probably the potential for a competitor on the horizon, so this will be actually make the picture even more confusing in a sense, because but yeah, I think, and I don't know when that's going to be released, but probably in the next year or 2 years that could be out there.
Yes, that is a good thing to keep in mind with that looming on the horizon. Well, excellent. thank you so much, Arun, for the talk today. Great feedback. Thank you very much.
Sure, thank you. Thank you very much.
Have a nice evening.
Okay, bye.
Bye.
Thank you, you too. Yeah, bye.